Welcome to the Career Pathway Channel, guiding nurses on the pathway to success.
Hello great nurses, welcome to the Career Pathway Channel. Here we guide nurses on their pathway to success. This playlist is very essential for all nursing students. It will interest you to know that many students understand anatomy, physiology, and med-surg but still fail their exams. Not because they lack knowledge, but because they lack the English to express it. Master the English language, and your grades will rise with your understanding. For this playlist, we'll be looking at the following course objectives. 1. To understand the concept of communication, we will know how to make oral presentations, we will know the essential elements of correspondence, and then we will know the rules of comprehension and interpretation. We'll also understand the meaning and scope of a library. We'll also know how to use the library. For the purpose of this video, all 6 objectives for this course, GNS 102, have been put into modules. So we have module 1 to module 6 for GNS 102. This video will cover GNS 102 module 1. Here in module 1, we want to understand the concept of communication. As we look into the module, the priority circles are as follows. Red circle tells you that these areas are a must know for your exams. Orange circles make you understand these areas are good for clinicals, and green circles ask you to skim through this video at later times. These are the specific objectives for module 1. Here in module 1, we'll define communication. 2, we'll analyze the purpose and processes of communication. 3, will explain the relationship between communication and language. 4, will explain the impact of interference on communication at various levels, example phonological and syntactic, and so on and so forth. 5, will explain code mixing and code switching and dissonance in communication. What is communication? A nurse who cannot communicate effectively may fail to assess a patient's pain correctly, misinterpret symptoms, or miss critical cues during handovers. Section 1. Want to define communication. In its simplest form, communication is the process of sending and receiving messages to share meaning between 2 or more people. It's not just talking, it's listening, it's understanding, it's responding in a way that makes sense to other person. For example, a patient describes chest pain and you re-explain it to the doctor clearly, using the patient's exact words. That's communication in action. Take note of this exam tip. When defining communication, always include the idea of meaning sharing, not just sending information. So whatever definition you give for communication, ensure that sharing must be in your definition. So communication means sending and receiving plus shared meaning. That's communication. Objective 2, we want to look at the purpose and process of communication. So here we'll be looking at the purpose of communication. At the end of this page, we also look at the principles of communication. Why do we communicate? In nursing and life, we communicate to 1. Inform. For example, telling a patient their medication schedule is communication. 2. Express feelings. We communicate in order to express feelings. For example, reassuring a scared child before an injection is communication. 3. We communicate in order to persuade. For example, convincing a patient to take their prescribed medication. That's communication. 4. We communicate in order to build relationship. For example, earning trust from patients and colleagues is a form of communication. Remember this with the mnemonics pi b. So whenever you are asked in an exam situation, what is the purpose of communication? This is what your answer should be. Take note of the mnemonics pi b, where P is persuade, I is influence, E is express, and B is build. The principles of communication are as follows: clarity, consistency, attention, integration, and feedback. These are the principles of communication. We want to look at the process of communication. The process of communication has 6 main parts. 1 is send, which is encoding. The sender is known as the encoder, is the one who sends or creates the message. Number 2, the message. The message is the information to be shared. 3 is the channel. The channel is the medium such as speech, writing, or chats. 4, the receiver. The receiver is the decoder. Person who gets the message is the decoder. Feedback, the response. The response that shows the message was understood is feedback. Noise, anything that interferes. So these are the process of communication: sender, message, channel, receiver, feedback, and noise. The acronyms or these steps may change depending on what your instructor gives to you in the class. Without feedback, you can't be sure your message landed correctly. This is a possible question. So communication is not complete without feedback. Use the mnemonics SMCRFN: sender, message, channel, receiver, feedback, noise. Example: a nurse giving a report on a patient to another nurse. The nurse follows the process of communication. She sends the message through a channel, the other nurse receives it and responds back. If there is a noise, there won't be feedback. So this is the channel of communication. Let's look at objective 3, relationship between communication and language. Communication and language. Language is the main tool for communication. Without a shared language, even the simplest instructions can be misunderstood. In nursing, using clear and simple language helps patients understand their care plan, especially if they speak different dialects or languages. Example: explaining medication in English, then simplifying terms for a patient unfamiliar with medical jargons. This is communication. Objective 4. We want to look at interference in communication. Interference is anything that blocks or distorts the message. It can happen at different levels. Interference can happen at a phonological level, it can happen at a syntactic level, or a semantic level. If it happens at a phonological level, it is called phonological interference. Phonological interference changes the meaning of a word or a statement. That is phonological interference. It is usually caused by mother tongue. The second one is a syntactic interference. Syntactic interference occurs when poor grammar alters clarity. For example, a nurse says, "return it back," or "I am hearing you," or "as I have said." These are syntactic interference. Number 3, semantic interference. Interference could be semantic, and what it means is that wrong words of choice cause confusion. For example, sponsorer, reverse back, stranger. These are semantic interference. For example, saying shooting pain might frighten a patient compared to saying sharp pain. So you can say the patient has a sharp pain instead of saying the patient has a shooting pain. Objective number 5. We want to understand code mixing, code switching, and dissonance. What is code mixing? Code mixing is the usage of elements from 2 or more languages within a single utterance or conversation. For example, please take your tablet before supper. Supper in a language could mean sleep. So there is a mixture between normal English and the local language. This is code mixing. It is common among bilingual nurses or patients. This can enhance understanding if both parties understand both codes. But the risk here is there may be confusion if it's not mutually understood. The next thing we'll look at is code switching. Code switching is a conscious switching between languages or dialects depending on audience or situation. For example, a nurse speaks formal English with doctors but switches to local dialect with elderly patients for comfort purposes. The advantage of code switching is that it will build rapport to show cultural sensitivity. In nursing, it is vital for patient-centered care, so there is need to adapt communication style to patient comfort level. The next thing we'll look at is dissonance. Dissonance is conflict or inconsistency in communication, leading to mismatch between verbal and non-verbal cues or conflicting messages. For example, a nurse says, "I'm here for you," while looking at her phone. This sends a mixed signal to the patient and could erode trust for the nurse. Here is a cultural dissonance. Example, direct eye contact is usually seen as respectful in some cultures. This is seen as rude in other cultures. The nurse must understand the concept of dissonance in order to relate properly with diverse cultures. As I round off, here are the circles to success. Take note of the definition of communication. Take note of code mixing, code switching, and dissonance. Answer these questions in the comment section. Which part of communication process confirms a message was understood? 2. In the communication process, what does the S in SMCRFN stands for? Drop your answer in the comments, and in our next video we'll explore the organs of speech with diagram, making it so simple you will draw them perfectly in your examination. I want to thank you for staying tuned up to this time. If you haven't subscribed to our YouTube channel, kindly subscribe and hit the notification bell. Let us know what you think about our videos. Till we meet again, is bye-bye.
The Career Pathway Channel, guiding nurses to success.